Catheters are something that is around, but generally only used if absolutely necessary and prescribed by a doctor or specialist. So it's mainly used for someone who can't empty their bladder at all or not very well. It can be used, often people might have it after surgery, or some people who have a bladder that doesn't function very well might have it more long term. Catheters can either be through the abdomen, which we call suprapubic, so just above the pubic hairline. There might be a catheter that's been inserted through the tummy, or indwelling, which is through the penis or through the urethra or just above the vagina in a woman. And they drain continuously into a drainage bag, which is either a leg bag during the day or a bigger night bag overnight. Sometimes people also use a little valve on the end of the catheter, so they empty the valve directly into the toilet every sort of 3 to 4 hours, depending on how much urine they produce. We don't often use it for people who have incontinence, for example, if they rush to the toilet and can't get there in time, or they cough and sneeze and leak urine. It's generally not used for that type of incontinence. It's more used for people who have problems emptying their bladder or getting the wee out. Occasionally we might use it for someone who's got really bad skin problems, or say big pressure sores on their bottom, just to keep urine away from the skin. Or say if they're at the end of their life and in palliative care, it might be something that if it's really difficult for them to go to the toilet and they're having, again, possibly skin problems, or it's quite uncomfortable for them, we might consider a suprapubic or indwelling catheter. Intermittent catheter is when you use like a fine tube and you insert it into your bladder, say, every 4 hours or so often. So you're basically mimicking what your bladder normally does. But the catheter just goes in, you drain the bladder, and then you remove it, throw it in the bin and repeat that as required. Some people it might be every day. Some people it might be for every single week. They need to pass an intermittent catheter. When it comes to any sort of catheter, generally a nurse will be involved in teaching you how to look after your catheter. Suprapubic and indwelling catheters generally need a nurse or doctor to change that catheter. Intermittent catheters might be something you're taught to do yourself. But as I said, it's not usually something that's given out quickly and easily, because there is consequences, because anything that's inserted into the bladder has a risk of infection. There can be risk of damage to the bladder and bladder neck. So we're always very cautious about any use of catheters, but they are around.